Good morning, and welcome to the 19th in our series of special webinars about the challenges North Carolina is facing as we react to COVID-19. I am Pat Cronin with the Institute for Emerging Issues, sitting in for Leslie Boney. Today, we've got the second in a series of 3 episodes looking at the impact of COVID-19 on early childhood learning. Today, and in all of our episodes, we're asking the question, how can we turn this crisis into an opportunity to build something better than we had before the pandemic hit? To briefly recap, 2 weeks ago, we looked at parenting education programs and how they are teaching thousands of parents across the states key skills when it comes to promoting the health and education of their children. A recording of that show is on our website, emergingissues.org. Today, we'll focus on childcare, and on August 27th, our final episode will examine child mental health. Experts fear that the pandemic has unleashed a wave of trauma among children and adults alike. And our final episode will ask, what has been the impact of the pandemic on child and family mental health? And more importantly, how can we best support all children and families long after this crisis is just a bad memory? We hope that you'll join us on August 27th. And now on to today's episode. If there's one thing that the pandemic has made clear to parents and their employers, it's the value of childcare. And by childcare, I mean the early education and care services a child aged birth to 5 receives, whether it's in a center, a school, or home-based setting when not in the direct care of a parent. As our economy reopens and parents go back to work, will they have a place to send their children? And how can we create a childcare system that meets the needs of parents, employers, and the people who work in the childcare industry itself? Here to talk about these questions are 4 distinguished guests. In alphabetical order, we have Sheila Arias, a parent and campaign associate with MomsRising, a national organization advocating on behalf of women, mothers, and families. Marsha, Basloe, president of the Child Care Services Association, which works to ensure affordable, accessible, high-quality childcare for all families through research, services, and advocacy. We have Rhonda Rivers, a regional director of curriculum and training with LeafSpring Schools in Charlotte, a provider of early education childcare programs. And finally, Sepi Saidi, president and CEO of Sepi Inc., a design and engineering firm with offices in North and South Carolina, and also Florida. Ms. Saidi is also first vice chair of the NC Chamber, the state's largest organization advocating on behalf of business. During the show, we welcome your questions and comments. Please use the chat function in Zoom or comment on our Facebook page, and we'll try to get to as many of your questions and comments over the next hour. Before we go in depth on the impact of the pandemic, let's start by checking in with each of our guests. The same question to each of you, starting with Ms. Arias. From your perspective, why should we all care about childcare in our state?
Thank you so much for having me here this morning. To get right to the question, we should all care because we don't get to do it over on the early years. We don't get to second chance to make sure that our kids are ready for school. So it's critical that children have access to quality early care from birth. And that is so the 2 generations approach, high quality care is important to develop for their children long term, and I can really testify for that. It's also critical, important for short term for family community securities. And families need affordable quality care in order to be able to work and support their family always.
Always. Thank you. Mrs. Rivers, how about you? Same question. You're on mute there, I think.
Good morning, and thank you for having me. Well, childcare is critically important. As a mom, a childcare provider, a lifelong educator, the decision of where I would have my children has always been the most important decision I've made, and all of my work decisions have been centered around that. And I think it's no different for all of our working families in North Carolina. So what's so important about this and why childcare is so important is that, first of all, we realize that this is an opportunity for us to help establish a healthy foundation of learners, developing every area of their lives, so that it really is our early investment in our future workforce. I call it very much like the stock market. So it's such an amazing opportunity for us to invest in our youngest citizens, and that is critically important, so that in 20 years from now, however long it may be, we have a healthy, competent, and confident workforce. In addition to the fact that that is the single most important factor that helps drive parents' decision about whether they're going to be able to get back into the workforce, which we know now more than ever strengthens our economy. So,
well, thank you for that. Ms. Saidi?
Good morning, Pat. It's so good to be here. Childcare is such an important topic for me, and I'm sure for everybody on the panel. And I consider childcare and child education to be the same thing. We're not actually talking about the children that they just have to be supervised. It's about when we are talking about very early on children that have access to quality care, where they are also being taught numerous skills and educational opportunities. So investment in childcare, in my opinion, it's investing, as we do as a state, in K through 12. It has to be earlier. We need to pay much more attention to those very early years. Those very early years, as everybody knows, shapes a human being. So investment in that early years is going to ensure that we have adults who are going to be contributing members of our society, who are going to lead us into the future, who are going to shape our future. So for when we talk about early childcare, a lot of times folks think that we're talking about, well, you decide to have children, why do we have to take care of your children? But that's not how we should look at it. We should look at adults' ability to be able to, we are investing in our future adults to be able to be further contributing members of our society. And also, what is really important to me and close to my heart is ability for women to be able to have careers. When we don't have adequate childcare, first of all, women have to sacrifice having a career to have unpaid work at home. So, and not honestly being recognized for it. So it's really important, especially during the pandemic. We don't want to lose a great deal of talented professional women who have been able to come to the workforce because they have no other option. So there are many facets to it, and extremely important. Thank you.
Wonderful. Thank you. And Ms. Basloe, anything further to add to those very strong responses?
I have to say it's really wonderful to hear everything. Thank you for having me. I feel as though we've really made an impact, unfortunately, in this crisis, but it really is the best two-generation model that we have. You know, it takes care of our youngest children to grow the next generation, and it helps working parents so that they can go to work and be productive. It's kind of like building a house. You can't build a house without the foundation. Mm-hmm. And we know that early childhood is the foundation, but you also can't live in the house and operate without having that strong foundation.
Right. And of course, you're referring to the brain science that has really come out in the last 10 or so years, which proves beyond a doubt that those first years of life in a baby's brain are so important to building that strong foundation. So build a strong foundation in the baby's brain, you set that child up for success in school and life later on. Very good.
It's our future workforce.
It is indeed our future workforce. Well, with that in mind, let's turn to the pandemic and take a look at how the pandemic has been impacting the childcare sector. Ms. Arias, back to you. You're a parent and a parent advocate. What's been the impact of the pandemic on your family broadly and on other families that you know?
I think it's very important to highlight that the difference for mine, it's totally different from another family, but it definitely, we can all relate to the fact that it comes down again to childcare. I'm personally caring for my niece who has a single mom, which is my sister, and who has been waiting in a waiting list she's almost 4. So we've been in a waiting list for long just to try to get a spot so we can go ahead and put in a childcare setting. But right now, it made it even worse, the fact that there's not childcares open enough and we're still waiting for money. So we're trying to manage within our own family settings to take care of our needs. And it makes it a little bit of a challenge for me working from home, caring for my 2 kids. And then on top of that, trying to manage to care for my niece. So it has definitely affected that. And I think, talking to other families, they can share the same experience along these lines as well. And we also have moms who have made the really hard decision to quit their jobs so they can stay at home and care for their children because they have nowhere else to take them right now, And so even if we're speaking about taking our children to a family member that we know and that we trust, well, that family member knows somebody else as well. And so they already have so many children in their home, plus their kids. So it has been a challenge just caring overall.
Right. And I know from an earlier conversation, your sister is an essential worker. Is that right? She has to go to work. So somebody has to watch her 3-year-old.
Absolutely. Her position has definitely gets more challenged throughout the summer, and someone has definitely watch her child. She hasn't stopped working since this happened. Instead, she has picked up extra hours because less employees are going to work due to the fact that they are tested positive for COVID or whatever, personal home situations. So we're in a unique situation where we can physically help her, but what about those families that don't have second options? It makes it even more challenging for them.
Thank you. Mrs. Rivers, you work in a daycare and a childcare setting.
Yes.
Are you hearing similar stories from the parents who send children to your place? How has the pandemic impacted your operation?
Very much so. So our struggles have been very much the same, and it has certainly been a challenge in so many ways. Our number one focus is keeping our children safe. And keeping our workforce safe so our parents have some place to leave their children. And so, listen, I think in the middle of this pandemic, childcare providers have added a whole new meaning to essential for the first time, because it is critically important that we put the time, energy, effort, the practices in place. Many of our teachers are single moms, but it's certainly dominated by moms that risk their lives every day to come, because they will continue, and they do it in such a loving manner to provide the children with all the nurturing, because there is no social distancing when you're a quality preschool, right? And so particularly with your younger babies in your infant and toddler class, they still need to be held and loved and nurtured. But many of these moms have the same concerns. They have children at home. They realize that every day they put their lives at risk or their health at risk to be at work, but they do it because they love it. And it's important that we make sure that we return the investment and provide them the safest situation possible, because if they're not there, the other essential employees can't get back to work. Myself, I have 2 school-age children at home. And as these schools are trying to decide what they're going to do, and many of them are the school-age population, K-12, as they're deciding whether they're going to open up, and many of them will be remote. Remember, many of our preschools, particularly ours in Charlotte at LeafSpring, we're still open to the school-age population. So we're trying to figure out those kinks. How do we keep the children safe? How do we keep them in small groups as possible and provide a healthy, safe, but yet still give them quality experiences while they're there. So it's time well spent, so their parents have the peace to go back to work feeling that their children are in the safest situation possible. So it's a challenge. We're doing it, but we realize that we must stay open to get our state open completely.
And during the pandemic, have you been operating at capacity, or did parents pull their children out for one reason or another?
Pat, we have had some parents that have been understandably so, really anxious about whether or not to bring their children. For the most part, we're at about 75 to 80% capacity. We're fortunate because we're one of the only schools in the state that we have pediatric nurses on staff every day. So we just have that extra eye and making sure that screening and asking the right questions. But that doesn't mean it doesn't happen. You can do all the right things sometimes, but this is still what we're dealing with. But most of the parents need to be at work. We have many of our families are essential employees. They're nurses, they're doctors, they are in all different lines of work. Even with when you're thinking about IT, those systems have to be at work for other operations that we see as more essential to be at work. They have to be at work. So we're just grateful that our focus is on quality and safety, and it has always been that way, because those parents who have to go to work must have some place to take their children. So we're at about 75, 80% capacity right now.
Okay. And Ms. Arias raised an important point, which is the differential impact. Not all groups are impacted equally by the pandemic when it comes to childcare. So women as a group are probably unduly impacted and making those decisions about how children get cared for. But I think you raised another point, which is in the childcare workforce, at least nationally, that's heavily populated by women of color. Is that correct? Yes. Is that also in the case of your school?
That is absolutely the case. I spoke with one of our teachers this morning. She's an amazing childcare provider and an infant teacher. And she's a mom with 3 young boys. And, we discuss all the time, how do you feel safe coming to work? She said, I do, because we have so many safe practices. She said, but at the same time, it's a little scary, because I realize that if I take it home to my boys and her mom, who has underlying health issues, who lives with her, then that would be such an unfortunate situation in her home. But that's a risk she takes every day so that our families who work in the state of North Carolina can get back to work. And that's the relationship we have with them. So it's scary, it's unfortunate. We're committed to this work. And for the first time, we feel like we have the ear of many of our North Carolinians to realize that we have to continue to invest more in our teachers, our staff, so that we can give the families what they need in North Carolina.
Right. Ms. Saidi, what childcare issues have you and your employees been dealing with as a result of the pandemic?
I feel extremely fortunate that I have adult children and they're not children anymore. I can't imagine having to do distant learning. And to Rhonda's point, the value of teachers and childcare providers have been magnified significantly. I have heard from many of the staff in my office and others who have small children that they're saying, we had no idea what a difficult job it is to teach.
Yeah.
So I hope that we as a state, we look into investing further into teachers' pay and valuing teachers. And I will get to your question in a second, but the other part of it is that I'm a part of a group of CEOs that was led by Dr. Goodnight, that we have asked the state legislators to invest in early childhood education, which is pre-K. Mm-hmm. And that has been proven at NC State. There has been studies that it shows pre-K investment directly results in better reading proficiency at 3rd grade, which is extremely important mark for future of our children. And it has proven that that children who are able to go to pre-K have much better results. So I think that as a state, we really need to make sure that we invest in pre-K, especially when we are looking at our minority communities, find that the communities that have less income, the Latino, African American, other minorities, they are heavily impacted. It is a responsibility of us as a state to look at those data and consider how can we do a better job to support the early childhood education, to pre-K, various ways to support families so we have a healthier community. Going back to my office, I believe the most important thing that I can offer as a CEO is to create flexibility for our employees. Mm-hmm. And I think the key has been flexibility. So we are working with employees. Our offices are open at a minimum capacity, and we call it a hybrid work environment, where we have set a protocol for those who are not able to work productively at home. They can come to the office and follow the safe protocol. And so that has been helpful, but also for the ones who have young children at home, we are focusing on flexibility. They don't have, if they cannot be there on the Zoom call at 8:00 in the morning, we're focusing on achieving their goals, their results, and work with them to be able to get their work done. So I think that's something that I have seen a lot of organizations do. I hope they more do that. Flexibility to work with employees can really go a long way in that ability, so that they could work with their children potentially in some hours during the day and make up their time in the evenings or weekends. So we are being very flexible, and I have seen that to be positive.
Right. And did I hear you say you're hearing similar stories from other business owners as well?
Yes, definitely. Similar stories, and also the value of teachers. It's become magnified for all the parents to say, my God, we had no idea how tough this is to get all of the students' attention and keep them productive and get good results. So I really think it's important for us right now and as a state to invest further into teachers' pay and to early childhood education and pre-K.
Okay, I want to definitely circle back to what we need to be doing just a little bit later, but thank you for taking that up. Ms. Basloe, when you look at the state as a whole, are these typical impact stories, the impacts that you've just heard, are they magnified across the state?
They are magnified across the state, but I want to thank you for your support of the workforce. You know, I think about the early childhood workforce as the workforce behind the workforce.
That's right.
And we really, in North Carolina, have focused for years on educating our early childhood workforce. We have one of the most educated early childhood workforce in the country because of the Teach Early Childhood program, which my agency runs. But it really is a difficult job, and it needs to have an education. And so we are the workforce behind the workforce. We also know that it's really important to take care of babies. And so the 4-year-olds are fabulous, and I love the pre-K program, but I do want to mention that our babies are also important. And Rhonda and I and Sheila are part of a Think Babies coalition that really is extremely important, because if you start at the early ages, it will be easier for our preschool children as well. So I am hearing this across the state. I will tell you that I'm pleasantly surprised to hear about the flexibility of business, because that's really what's going to be needed to have this be successful. We are, and I think that what we need to think about is the fact that for many, many years, we relied on policies to expand access. Although, unfortunately, Sheila's sister didn't get access, it's because we need more money for access. But that is really where we focused. And we paid almost no attention to the supply side and helping childcare providers to have the dollars to pay our teachers. Our early childhood teachers on average earn about $10.97 an hour, and they don't necessarily have benefits. And we really do have to make a difference. And that is going to make a difference for our state and our economy when that happens.
Yeah, I'd like to circle back to some of the underlying challenges that I think COVID has exposed. But first, maybe we can put up your slide, the North Carolina Snapshot. And if you could just briefly walk us through kind of what was the impact from a provider perspective across the childcare system.
Sure. I think one of the things that you'll see in this slide is it's almost a month old, so I do have some new data. But you'll see that prior to COVID, we were serving 265,432 children enrolled in regulated care. And about 25% of them received child care subsidy. We had 5746 licensed child care facilities, both centers and homes. And we had about 41,000 teachers and staff. You can see that during COVID, the number of programs that were open changed. I think that North Carolina has really done an amazing job, and it's really because of programs like Rhonda's that really have cleaned and have educated workforce and really are making sure that families can safely send their children to care. But we are looking today at having almost 4,000 programs open, 3,935 total programs open. The challenge is that we are only at about 52% occupancy rate for centers and 75% occupancy rate for homes. And in order to survive as a childcare industry, because we were already operating on such a slim margin and really underfunded to begin with, to operate at 50%, 52, 53% occupancy means that how long can you do that before you really have to close? And so therein lies the challenge of what we can do to support the early childhood programs while they don't have full enrollment.
That's right.
Okay, so there was as I read these graphs, there was a huge drop off. A lot of centers closed. A lot of the home-based or the centers closed, and they've been slowly reopening. Many have reopened, but there's still a good chunk that have not. There was a drastic fall off in the number of children attending, right? If I read it correctly, we went from 265,000 down to about 50 pretty quickly, and that has gotten up to what? Maybe about half the kids are back? Is that?
No, not yet. We're at about 104,278 children. We are moving it. But I think one thing that we need to keep in mind is that we had 265,000 children in care when we had a 3.5% unemployment rate. Mm-hmm. And really, everybody was working. Right now, everybody is not working. And so it would be hard to think that we would have 265,000 children in care at this point.
Right. But of course, if we want to move back to anything resembling 3.5% unemployment, right, we need to get on it, right?
Well, we need to make sure that the child care programs survive so that when our economy opens up again, we have child
Absolutely.
care for everyone. If we don't do
so let me ask you, just stay with you, Ms. Basloe, for a moment here. Is it fair to say that the pandemic exposed already existing underlying weaknesses in the child care system? And maybe you can just speak to what those are. I think we've been hearing a bit about them already in the conversation.
Well, the child care industry has always been fragile. And I think, as I said, it's been always fragile because we've focused on spending money to get parents affordable childcare, but we haven't spent the dollars to focus on the supply side. So we do need to have educators that are qualified, and we need to pay them. It costs money. They're small businesses. Every one of our childcare programs is a small business. They have rent, or they have mortgage, they have payroll, they have everything that any small business has. And we really need to invest in that small business. So we have ratios between children. Any small business has their operations, but we have licensed ratios so that we can have safe childcare. That's, health and safety is first and foremost in the early childhood programs. It's really why North Carolina has done such a good job of having 101,000 children back, is because early childhood teachers, they are the best at health and safety. They know how to keep children health and safety. They wash hands constantly. And so we can really teach others how to take care of the health and safety of our young children.
Right. Mrs. Rivers, let's turn to you. So at a center perspective, we're hearing that there's a business model challenge here, right? For parents, it's incredibly expensive to send a child to childcare. I think back to my days. My baby's now 20, but I can remember writing a check every month that was about as big as my mortgage payment to have him in a childcare program. And I I know from looking at some statistics from the Department of Health and Human Services that the average family pays 10 to 12, even more % of their income on childcare, which is a huge burden.
It is.
But at the same time, talk about what are people earning in the childcare sector? For instance, in your center, are people getting rich working there?
Well, absolutely not. But I will say this, no, and it's not that profession. That's why it's so important that we continue to be a voice in forums like this, that we don't undervalue how important it is or not understate the importance of our childcare workforce. It is expensive. The operational cost and a quality childcare center is expensive. Prior to COVID, we've invested a lot of money, as I mentioned, at our school. And I'm just sharing this because every school is not fortunate enough to have this. Well, we staff nurses. So there's a nurses staff. We have several teachers that are involved in Teach, as Ms. Basloe just mentioned, and which is such an amazing incentive to be able to offer our teachers to be a part of that scholarship program, because education is so important to us. And we understand it's important to have a quality, educated, and well-informed workforce to be able to provide those, to be able to really give those youngest minds what they need to be that stable and confident foundation that we're talking about in childcare. But with that being said, it's expensive to operate, even with our schools being at 75 to 80% capacity. Please understand that that is a great loss when you were at 100% capacity with a wait list. We do pay our teachers more than the average, and we're very excited for the schools that we have, that I work for, that is important, because we understand, even in this pandemic, when numbers were low when COVID first started and we only had 20, 30 kids, our executive team was committed to doing everything that we could before PPP came along to keep our workforce employed, because what she shared with us is what's most important to me, that when this is all over, that I still have my high quality teachers in place. And that's important. We invest in their education. It's important to us for them to make livable wages so they can afford healthcare, because as I mentioned, Lord forbid, if in caring for these little people, if one of them gets COVID, they're taking that back home to their children. And then they're out of work and they need to be able to afford whatever healthcare. And unfortunately, in the state of North Carolina, many of our teachers do not have those benefits that they need. We're fortunate to be able to offer that. That's why we have to continue. And we have to make sure that sometimes in a situation where men are making most of the decisions, that they understand the value of childcare, where, as Ms. Sepi mentioned, that a lot of this is whether or not women can get back to work to keep this economy healthy. And if we're not there to provide that quality and that sense of peace for parents, as I mentioned, as a working mom, every decision I made about a position I was going to take was around, where am I putting my babies? And if it is a safe place, we've seen, Pat, that in some situations that moms and parents have been looking for more flexible situations. Should I take my child out of childcare? Should I find a babysitter? Should I find a nanny? And that's our reality. But one thing that we can offer that those situations is safety is still most important. And in a regulated quality preschool experience, that can't compare to anything. Our teachers are first aid CPR certified every year. They have the infant talk, they have ITSIS, so the sudden infant death syndrome safety training. Those are practices. So it's really important for parents to still be very cognizant and to be clear about the situation they're putting their children in for those costs. So, but one thing we have found, that in a situation where parents know that they have an opportunity to put their children someplace that's safe and that has safe practices and an educated workforce, they will make every sacrifice that they can to make that payment for that. So we just make sure that we are diligent about how we spend those funds, and we're putting it back into the programs. We're putting it back into maintaining those high quality teachers. We're so fortunate to be a part of the state of North Carolina. I have to say this, that our Division of Child Development and Early Education has done such an amazing job, and groups like Child Care Services Association, our partnership, and providing great PPE funds to make sure that we just got great donations for masks and and for sanitizers and for thermometers to make sure that we're doing everything we can for that. But it's expensive, Pat, to operate and to be able, when you're paying your teachers well, to keep them employed and to provide benefits, it is expensive. It is expensive.
Right. And many centers can't do that, right?
Many centers can't do that.
Home-based. I was looking again at the statistics out there. The North Carolina Early Education Coalition says the average wage is $10.50 an hour.
Yes,
in the
right.
childcare sector. Do the math. That's poverty wages for these workers who we consider essential, right? The workforce behind the workforce.
That's correct.
Best NC reports that the median, so the middle, half above, half below, early childhood wage last year was $22,000 for a child care worker. Again, nobody getting wealthy on that. And as you mentioned, from the business operations standpoint, you need full capacity just to eke out a profit, right? And
That's right.
Employees are not getting paid well. And as Ms. Arias said earlier, it's incredibly expensive. So Ms. Basloe, one way we've tried to deal with the high cost to parents is to provide subsidies, right? But we're only reaching a certain percentage of the population that could really use those, correct?
We are. First, I have to say that we do need more subsidy dollars. When before the pandemic, we had about 41,000 children on a waiting list. Think about that a minute. That means that you've had a baby, you've got your name on a wait list, and you might end up being 4 years old before you could have a subsidy to help pay for childcare. That child has not had the ability for a high quality childcare experience. Right now, our subsidy waiting list is it's still there. It's probably about 14,000 children. And I don't have that statistic, but that means that we have 14,000 children in the pandemic even that are waiting for childcare. So we definitely need more dollars in childcare subsidy. But I do want to mention that that's only one side of the situation, that we still have to really also focus on the supply side. We can't just focus on one side. It's about supply and demand. It's always about supply and demand. And we need to begin to think about how that works in our state and in our community.
Okay, and wonderful. And let me just remind the audience, please put any questions or comments you have in chat, and we will try and get to those as we go along here. Let me just mention, Ms. Basloe, you said there were about 13,000 children on the waiting list. Is that correct? That's for 0 to 3 care, is that?
Actually, that's for 0 to 5. I wish it were for 0 to 3. I'd love to be able to separate 0 to 3 and 3 to 12, quite honestly. But that is for birth to 12, actually, the age of childcare that we can use the federal funds for.
Right. And I had seen a statistic, a little old, 2017, looking just at pre-K. So in the NC pre-K program, 46% of eligible 4-year-olds were not being served by NC pre-K. That was almost 34,000 children. So just underscoring that there are a lot of families out there who are income eligible for these types of subsidies, but are not being served because the money is not there for them. Which really, of course, puts the burden on them to make do, as Ms. Arias had earlier talked about in the context of the pandemic. I
just want to mention it does speak to Sepi's point about growing our NC pre-K program and how important that is. Right,
and let's take a quick look at that. If we could put up the slide with the NC pre-K map of North Carolina. This illustrates nicely the question of where across the state eligible 4-year-olds are being served or not. Ms. Saidi, you are part of a group of CEOs who are pushing to create a situation where up to 75% of eligible children across the state should be able to be served by the NC pre-K program for 4-year-olds. So on the screen, you can see the counties in green have over 75% of those children being served. But the darker the reds, if you will, those are the counties where fewer and fewer of the eligible children are being served. Overall, you can see on the right there that 54% of eligible children are not being served. That's 34,000 children. That was in 2017. So you can see that we've got a real problem here. There's a lot of need, but not enough money being channeled to provide those kinds of subsidies.
Right. A couple of statistics that I can read on this talk is that the results show that if reading proficiency at third grade is achieved, the students are 3 times more likely to graduate high school and enter post-secondary education, if not met, 4 times more likely to drop out of school.
Yeah.
So this is just a few of the really important, impressive statistics that shows the importance of third grade proficiency, which is a result of investing in pre-K education. So it really could benefit our state in a big way.
Right, exactly. So let's talk about the future and where we need to go and what we need to do. So I'm going to ask each of you to tell the audience, describe a childcare system that meets your needs. What does it look like? So Ms. Saidi, we'll start with you. As an employer, what's a childcare system look like that meets your needs?
So I think I already spoke to that earlier. I believe childcare, which means honestly is from age 0 to 18. We have to, as a state, we have to get all the stakeholders together to look at a comprehensive plan. It has to be a major commitment from the state, also from the business community. So for us to work together in creating an affordable and reliable and safe childcare system for all of our citizens, especially in the low-income areas where their access to private care is very, very limited. And so I think that we all, as business leaders, as policymakers, as advocates for this important thing, we have to get together and come up with a comprehensive policy. And investing, the state of North Carolina should consider seriously in investing in early childhood education and care in a major way. Teachers plays a big part of that. So there are various components that comes together. And it would make, for me as a business owner, would make me feel so much more comfortable to see the professional staff have reliable childcare, and they don't have to worry about that. They don't have to be, stressing and impacting their work, which again impacts what they do for our community. We're all connected. I think the biggest message is I've always said we are all connected together.
We're all
family, workforce, state. It's a continuous impact. So we have to think comprehensively.
Thank you. Yes, Ms. Arias, what's the child care system look like that would meet your needs?
The child care system that I envision is a good economy, and you can't have a good economy without child care. That is just, there's no question about it. But also, a child care that respects widely the cultures and the language that families need, because we are very diverse in this state. So definitely thinking about that. And also thinking and taking in consideration that our teachers are humans. They also have families, they also have children. So considering their pay, their health, and everything that a family needs. And really, it's the investment at the federal and the state level for our lawmakers and our representatives to really see the importance of early child care. And I can really testify for that because my kids benefit from these programs. And I know I have an 11 and 8 years old, and it made a critical impact soon when they started. So definitely just families would thrive and their children will be very successful, keeping in mind that we have second and third generation here. So those kids will have better futures for their families, for our state, and that will mean better economy for all of us.
Thank you. Mrs. Rivers, how about from your perspective?
Well, first of all, Pat, I think we can just start and probably end everything with a statement that Marsha made, and that was that childcare is the workforce behind the workforce. I think that pretty much summed everything up. And if we look at it that way, then our question is, how do we support, keep a thriving, healthy, high-quality workforce? Who do we need to have at the table to have those conversations? I see that Representative Horn is on, and he's been a supporter of early childhood. That's important to me. That's important to us. It is important that they hear the voices of teachers. And as I've said, and many of our friends and my colleagues on the coalition, Michelle Rivers, who was an amazing policy director, that talked about, we cannot talk about essential childcare if we are not talking about how essential the workforce is. So what do we do to support our workforce? They have to be in a safe environment. They have to have livable wages that complement and that show the value of their value, because all we hear is to get how do we open North Carolina back up? How do we get our state back working and thriving? That is for people to have someplace safe. If you are able to get back to work with these high unemployment numbers, you have to have someplace to leave your children. That's a safe, high quality environment. It's a win-win situation. First of all, they need it to be able to, so we can have an opportunity to use those teachers that are educated, that understand best practices, so that we are helping establish a strong workforce for the future. And in addition to that, we cannot get this state back to work. We cannot, parents are not able, Miss Sepi can't provide this thriving service that her company provides for the state of North Carolina if her moms and dads don't feel comfortable with where they're leaving their children. So how do we make sure that our workforce behind the workforce, they are due affordable benefits and insurance? It is an insult for us to assume that they should put their lives at risk every day to care for our children in a nurturing, high quality environment that, if I may add, is expensive to run, but we are not providing affordable options for them to care for their own family. You know, and that is what we do. That's what I want to see. That's what we have to see as a state and as a country, for us to make this country stronger than it was, for us to, where we were when when we first started with this pandemic, and where we are now, is that we have to continue to make sure that we put our funds, our sources, and our support in keeping the workforce behind every workforce healthy and thriving. Our schools cannot close. The doors have to be open. The environment has to be safe for our children to be able to return, and our parents to be able to return to work.
There is a question in chat asking about, what is the turnover rate? Given the low pay in the sector, what is the turnover rate like? I don't know, Ms. Rivers, it sounds like you pay higher, so maybe your turnover rate is lower than for the sector as a whole?
It is, and we're very fortunate. We have seasoned teachers that are there, and like I said, it's been a priority for us to make sure that our teachers have some place to come to work safely when this is all said and done. It is a high turnover rate. This is a service job for the state. Marsha can probably speak to more of what that rate looks like, because the numbers are unfortunate, but we have an opportunity now to do something about that.
Ms. Basloe?
Yes. So North Carolina has made an investment in our teachers as best they can. We have two programs. We have the Child Care Wages Salary Supplement Program, and we have a new program in the last 2 years that the state funded, which is the Infant Toddler Educator Awards. And they're tied to having our teachers get more education, and they receive a salary supplement. That has helped to reduce the turnover rate because they are getting some additional dollars. You know, I have to say that if you're making $11 an hour and you get a salary supplement, means that you're able to make $12.20 an hour. That's still not a livable wage, but it has made a huge difference in our turnover rate, our wages and our awards turnover rate. And I actually probably shouldn't give you a statistic, because I'm reading reports now to be sent in. But I know last year our wages turnover rate was down to about 16%. The average turnover rate without a salary supplement is significantly high, especially before the pandemic, when you could make $15 an hour at Target and you had benefits, and you couldn't actually do that in a childcare program. And really, taking care of children is very difficult. It's not easy. I think parents today now will say, we had no idea how difficult this was. And it is difficult, and you really want to continue to nurture the brain. So we do have to worry about the turnover rate. We also have to worry about the supply of teachers. Early childhood teachers need to go to school. And I just recently learned that there were a couple of community colleges that closed their early childhood program because because community colleges work on having full-time equivalent enrollment. We don't necessarily have full-time because teachers are in the classroom, and it's usually high need and high paid. We absolutely are high need, but we are not high paid. And so it's really important that we work with our higher education community, both at the 2-year level and the 4-year level, to ensure that there are programs so that our teachers can go to school and we can continue to have a highly educated workforce.
So let me ask you, it seems like the answer is clearly more money is needed. Parents don't look to be the answer to being able to pay the higher wages that we need in the childcare sector. So where does that come from, and how do we make that happen? And Ms. Saidi, maybe I'll start with you. You wrote an op-ed published last week at NC where you were talking about how we might move forward. I wonder if you could share your thoughts.
Yes, and that was it. You asked me the most difficult question. So where do we get the money from? That is important. As I said earlier, Pat, I think that this is a combined public-private partnership. We have to get support from the state, of course. That's extremely important. But also, I believe that private sector could play a big role, especially larger organizations, much larger corporations that have a significantly higher number of employees that could create some partnership with together to take care of that. I also really believe that we can be very creative about this. I've always thought that our K through 12 public facilities, public schools. So we build a really big, expensive facility, mostly invest a significant amount of money. This is not going to be popular, but I'm going to say it. We're going to invest a significant amount of money in our sports facilities. So we have this big football field. I remember at one point we were a part of this, looking at the school construction in Wake County, and we visited one school and it had an elevator in the football field. And I said, why are we putting an elevator here? They said, because if the journalist has is disability where they cannot walk up the stairs, they need to get to the press box with the elevator. So I feel also, I'm saying that to highlight that we also need to look at our priorities. I mean, when we have invest a significant amount of money on these facilities, and we create these amazing big parking spaces because the students have to be able to drive, right? So we're going to pay for this big parking space. We're going to pay, and why do we have to provide this big parking space? The amount of land we're putting it. Why do we have to be so much investment into a really tremendous football facility and all of this thing? And I say this is important. I'm not undermining the value of sports for young people, but there are creative ways we could manage that. We could use the parks. We could use our parks close to our public schools. So share some of these facilities. There are ways we could be creative about it. Then the schools could also house, in my opinion, and I'm not an expert on this, but I'm thinking these school facilities are not used as much as they could be, because there are a lot of times that the school is vacant. Could those times that the school is vacant be used for other needs? Can we house pre-K in there? Can we have childcare in our elementary schools? Can we have a childcare facility that it houses that same thing? So I'm bringing up these topics to say, I believe there are a lot of opportunities. And maybe when I talk about this, somebody says, well, that may not work. And I say, great, let's brainstorm about being creative with our resources. I believe that we can, if we make childcare, and that means a very young child, if we make that a priority, then we can be creative with it. Then we can start thinking, where are we spending money? What are our facilities? Where do we have public libraries? Do we have parks? Can we combine some of these state-funded or local, county, or municipal-funded facilities to also house childcare? So I think the most important thing I would say is making that a priority, making childcare and child education a priority. And when we do that, then we're going to see a lot of solutions.
Well, I was struck by your call at the end of your op-ed about how this is a time for everyone impacted by childcare to get together around the table and to talk about how we solve this problem. I'm going to put you on the spot one last time, and then I'm going to do a quick final round the horn, as it were. You're going next year. You'll be chair of the NC Chamber board. Are you going to make childcare a centerpiece of what you want them to focus on in the coming year?
I think that there's already, Pat, a significant support at the North Carolina Chamber for childcare education. So that is not going to be something that, honestly, I have to pay attention. It is already an important, really important topic that the Chamber is focused on. So the Chamber is a force for business. That's the tagline of the North Carolina Chamber. And as I talk about connectivity of everything, we need a strong childcare. We need a strong transportation infrastructure investment. So there is an important infrastructure investment to impact the health economic development. So I believe all education, infrastructure investment, healthcare, economic development, all are connected to create a more thriving, strong North Carolina, or to continue on this path. So I wouldn't say we need to make one only a centerpiece. I think we need to look at it holistically and make sure that we are paying attention to all of the factors, which I genuinely believe that North Carolina Chamber, with the leadership of Gail Salamino, an incredible team they have on, they are focused on all these four issues: economic development, education, infrastructure, and healthcare. So they're all important topics, and I will continue on supporting all of those.
We look forward to your leadership there as well. Very quickly, I'm going to go around to each of you. Are you optimistic now in the middle of this pandemic? Are you optimistic at all about our ability to solve this challenge? Ms. Arias, let me start with you.
Absolutely. I know that this pandemic right now could be a little bit hard to look to the future and see what tomorrow holds. But I think that the fact that it brought out so much more the needs, and it made people realize that where the investment needs to be, tomorrow brings a lot of promise. And I do believe that people and stakeholders, legislators and leaders are going to look at this because they want a better say and invest even harder on this so we can have a better tomorrow for our kids.
Thank you. Mrs. Rivers?
Absolutely. I'm very optimistic. It's just important that we continue with the practices that we found to be working during the middle of this pandemic, that we continue with that. We've been very fortunate for some of the funds that we've gotten from the federal government that the state has funneled to centers immediately. That will need to continue for us to stabilize and to grow and to keep child care continuing past this pandemic. So the bonuses that they were able to find and provide for teachers in those increments made a tremendous impact on keeping teachers in our programs for our workforce and families instead of losing them to Target and to Amazon. So if we continue making childcare, safety, and the workforce important as we have in the middle of this pandemic, as it started, I feel very optimistic and hopeful for the future of childcare. So we have to continue to put that focus on keeping teachers in the schools and keeping children healthy. And then I'm really excited about what the future holds for us. We'll take these lessons and we'll move forward with it.
Wonderful. Ms. Basloe?
I'm going to end by saying I too am optimistic. I believe that North Carolina now knows what we've always known. Early childhood is essential, and the early childhood workforce is the workforce behind the workforce.
As mentioned, employer flexibility, Ms. Saidi said, is really crucial, not just now, but going forward. And one of the pieces to solving our child care challenge is creating family-friendly workplaces in our state. Before we leave, I want to draw your attention to one new initiative from the North Carolina Early Childhood Foundation. Through their Family Forward North Carolina initiative, they are offering a rapid response program for companies in the hospitality and manufacturing sectors to support reopening and retooling and to keep children and families healthy. So if you work in that sector or you work with companies in that sector, please check out their website for more information. As we close, let me note that we're committed as an organization to engaging a diverse and representative audience in our work across the state. We'd be grateful if you could spare 1 minute to fill out a very short multiple choice survey to capture audience demographics. If you're on Zoom, you're probably seeing it pop up in front of your screen as I'm speaking. Very short survey. If you're watching on Facebook Live, please click on the posted link. That's our show for today. I'd like to thank our guests for a very impassioned discussion of this very, very important topic. My thanks to Sheila Arias, to Marsha Basloe, Rhonda Rivers, and Sepi Saidi. Leslie Boney will be back in 2 weeks from today to talk about another hot topic, how to get the most out of virtual learning. I'll be here on August 27th with the last in our series on early childhood learning, so please join me to talk about the impact of the pandemic on child trauma. Our thanks to the Duke Endowment for sponsoring this series. If you enjoyed today's show and you're interested in sharing this episode, please check out our website, emergingissues.org, where we will post both our podcast and Zoom recordings by noon tomorrow. You'll also be able to find our slides and links to supporting resources. Again, that's emergingissues.org. First in Future is produced by Greg Hedgepath and James Herrick. Kirsten Chang gets the word out and keeps our chat going. Simone Coleman does our research, and Renee Potts creates our slides. My thanks to all of them and to all of you. Stay safe and see you in the future.